And I want to thank the minister for her answer. There are 15 areas identified, and I have personally identified locations in my area for the mobile clinic speaker. And I'm going to reach out to the minister's office directly, because we don't have a single mobile clinic in Scarborough yet. Shame. And we have 24% positivity rate and essential workers, racialized community members who still cannot get their vaccines, and seniors, Speaker, people who are still waiting from phase 1. And if you're listening to experts, listening to Ontarians, well, let me tell you this. Doctors have repeatedly told us that Scarborough is on fire with COVID-19. Our hospitals are on the brink with ICUs full, and these patients who are critically ill with COVID are essential workers, the most vulnerable people. The science table has made it very clear that we need to prioritize our hardest hit regions, that we need decisive actions around workplace safety, protect our essential workers. Instead, on Friday, this government chose a police state over public health, chose regulations that unfairly harm low-income and racialized people like those in my community. Mr. Speaker, I want to quote Dr. Shail Rawal, who very beautifully said, "They looked at us in the eye and said, your labor is essential, but your lives are not." So, Mr. Speaker, my question is, why is this government refusing to listen to experts and provide paid sick days?
Thank you. Thank you.
I would say to the member, through you, Mr. Speaker, that what she's suggesting is absolutely not the case. You've already heard the indication that recognizing that there are 15 hotspot areas within Scarborough, Scarborough will be receiving additional vaccines. With respect to where people can receive the vaccines, I can advise that there are 51 pharmacies in Scarborough that are providing vaccines, 6 mass immunization clinics, and 4 primary care locations, which are going to be expanding, of course, as we receive more doses of the vaccine. But no one in Scarborough is being forgotten. Everyone who wants to receive a vaccine will get one, and we are going to prioritize people in their workplaces to make sure that they can be able to come in and get the vaccines. This is an area, you are in a hotspot, there's no question about that. We've recognized that. We're providing more vaccines, and we're going to make sure we have more mobile units go in to help make sure that people in their workplaces can receive them.
Response?